Hi, I'm Congressman Adam Schiff, and thank you for joining me on Facebook Live. It's a pleasure to talk with you. I hope you had a wonderful 4th of July. I enjoyed several fireworks gatherings and the parade in Sunland Tahunga, but it's a pleasure to join you now and be in a nice air-conditioned office. It's really scorching out there. But welcome to Facebook Live. Today we wanted to talk a bit about what's going on with healthcare. As many of you know, I spent a lot of my time focused on intelligence issues, certainly on the Russia investigation, but I think of much more immediate consequences, whether tens of millions of people are going to lose their health care. And it is astonishing to me that we had a House-passed bill that would result in 23 million people losing their access to health care. And the Senate bill was considered to be a dramatic improvement by our president. The House bill lacked heart, was mean. The Senate bill was supposedly much greater, but yet the Senate bill would result in 22 million people losing their health care. That's not much to crow about. And if there is a further Senate bill that is considered some kind of a compromise among the more moderate handful of Republican senators and the most conservatives, that would result in, let's say, a further improvement where only 20 million people would lose their health care. That, to me, is not something to celebrate. That would be a terrible tragedy for the country. All of this is not to say that there aren't things that can be improved about the Affordable Care Act. There certainly are. And I hope that we get to the point soon that Mitch McConnell alluded to, where we can actually look at what would be necessary to improve the delivery of health care in America. How can we increase greater competition? How can we bring back more plans into the exchanges and in particular deal with some of the problems in the individual market? All of these things can be done. We're already at the lowest levels of uninsured in our history, but we can still go further until we get to the point where we have truly universal care. That really has got to be what we all are shooting for. So who knows what the Senate is going to be able to come up with. I hope that they'll conclude that trying to do this on their own, trying to do it without working with the other side and working constructively is a mistake, and that we ought to build on what we have, address the problems that people have raised. That I think is the best way forward. But I look forward to your questions and comments on things. For those of you just joining me now, again, this is Facebook Live. I'm Congressman Adam Schiff. We're talking healthcare. Invite your questions and comments on things. Let me go with a few of the questions that we received up until now. We received one from Leah. Why can't they just fix what's wrong with the ACA? And why can't insurance companies sell in other states? That's, I think, a very important question. That's at the heart of some of the challenges that we face, and why can't we move beyond this endless debate over whether we repeal or not. There are a lot of things that we can do to improve the functioning of the current markets, to expand on the models within the ACA. We haven't had that chance, though, because to make improvements to the ACA up until now meant a resignation that the ACA was going to be with us, and one party was simply not willing to go there. But hopefully we're getting to that point where we can work on improvements. In terms of the issue of selling across state lines, I know this is something the President trumpeted when he was a candidate on the campaign trail. Many of my GOP colleagues talk about that as well. It would be wonderful if that was the simple solution to the challenges facing healthcare and increasing costs in healthcare. The reality, though, is much different. Many states already allow plans to sell across state lines. The reason why it's not all that successful is if you're a plan, for example, that's based out of Arkansas or you're based out of Texas and you want to sell in another state, you have to build out a network in that other state. You have to attract people to join that network. You have to invest that kind of infrastructure in doing that. That's not likely to reduce costs. And so you see, even in those states that allow the sale of plans from other places, it doesn't really tend to do much to improve the market or constrain costs in any way. What it does do is sometimes allow very young, very healthy people to buy out-of-state plans. And the reason why that in the long term isn't particularly viable is that then the remaining and sicker people are either left to fend for themselves or they're put in other plans. So you have the state's own plans bearing the cost of the sicker people, the out-of-state plans cherry-picking the healthier people, and that's not a particularly good prescription for improving the system either. Let's go to a question by Susan. And again, if you're just joining me, this is Facebook Live. I'm Congressman Adam Schiff. We're discussing healthcare today. Invite your comments and questions. Susan asked, will the Social Security disability program be eliminated? And if so, what will happen to the millions that are depending on it? Well, we're going to fight efforts to cut or do away with Social Security disability. As you probably know, Susan, it's a lifesaver for many seriously disabled Americans. The president did propose, notwithstanding his promises to the contrary, not to touch Social Security, to cut $64 billion in the Social Security Disability Fund, and that means that there would be very substantial cuts to people who depend on Social Security disability because they are so badly disabled that they're not able to work. But there is, I think, bipartisan support in Congress for this long-standing program that has meant an opportunity for disabled Americans to live not in poverty. So we're going to fight to make sure that the budget that we adopt doesn't include this rather draconian cut to Social Security disability. And sadly, this particular cut, like many of the other cuts, whether it's in home heating oil for low-income families or cuts to Medicaid, the hundreds of billions of cuts to Medicaid that have been proposed by the president and my colleagues in the GOP and Congress, it's consistent with efforts to essentially cut programs for the most vulnerable in our society and use that money to fund a tax cut for those that are doing very well. I don't think that's particularly fair, equitable, or good policy. We already see the widest gap between rich and poor in the country I think we have seen in a very long time, and these kind of things only aggravate that trend. If you're just joining me again, this is Facebook Live. I'm Congressman Adam Schiff. We're talking health care and the budget. Let me go to one other question. This is from Wendy, and then I know some of you have been posting as well, and we'll try to get to some of those questions as well. Wendy asks, I just want universal health care. Most Americans want and need this. Wouldn't it be nice if we didn't have to pay the majority of our paychecks to this when most other countries don't have to? Wendy, I think you're absolutely right. We ought to be striving for nothing less than universal health care where everyone has access to good, affordable health care. It's hard for me to imagine something worse than being in a situation as a parent, and I have 2 kids, where I would be unable to provide health care for my children or my spouse or myself. And we have a lot of families in the country that where people are working full-time, they're playing by the rules, they're doing everything they should, and still they can't afford health care. Or if they do afford health care and they pay for health care, they can't afford anything else. They can't make their rent payments or other necessities. They can't afford to go to school. You know, to some degree, this is all a matter of what kind of cards were dealt in terms of our health. Yes, there are ways that we can try to stay healthy, but a lot of it is determined by our environment, by our genes, and by sheer luck, and by forces that we don't yet understand scientifically about who gets sick and who doesn't. And I think we all need to put ourselves in the shoes of parents who have a child that they fully hope and believe is healthy, only to find out they have a serious condition that's going to require a lifetime of treatment that would otherwise bankrupt them. Or someone comes down with cancer and it would be catastrophic in terms of costs, and they'd have to sell all the possessions to afford treatment. None of us can tell when those tragedies are going to strike or who will be affected, and we all ought to try to understand and empathize with what other people go through and have a system where people can get health care and it doesn't have to tear apart the rest of their lives. So that is exactly what we should be doing, is helping to get to universal health care. We're closer to that now than we ever have been as a result of the Affordable Care Act, and we don't want to go backwards. And I think these proposals that we've seen in the House and Senate now would go backwards. So Thank you for your question. Let me go to a couple other questions that have just come in. Here's one from Michelle. Michelle writes, how do you keep the GOP from giving huge tax cuts to the wealthy while ripping off the poor and the middle class? Well, you may have anticipated what I was describing in terms of why would we cut Social Security, disability, why would we cut Medicaid, why would we bring about a change in our healthcare system that's been proposed now in House and Senate by the GOP that would cause tens of millions of people to lose their coverage. What is at the root of this? I don't think this is a situation where my colleagues in Congress affirmatively want people to go without health care. But I do think that there are enough people who place a higher priority on giving tax cuts than they do on whether people can get access to life-saving care. I don't understand that. I don't agree with that. I don't support that. And I'm certainly going to do everything I can to fight it. I do hope that we get to the point in the near future where we can stop fighting over repeal, stop fighting over whether 23 million people lose their health care or 22 million people lose their health care, and we can start fighting for providing health care to those millions that still don't have it. That's the kind of debate we should be having. How do we get to full health care? Not how many fewer millions should we legislate out of their health care so that we can provide a tax cut to people who have done very well and wonderful that they have, and we want to continue to have them do well. But we don't want to disenfranchise people from their access to health care. All right, let's go to another question. We have one from Georgia. Georgia writes, how can we implement universal health care? Rather, how can we support that effort? Well, I think what people are doing all around the country is really important right now, and that is that they're demonstrating their support for universal health care. They're showing up at town halls, they're writing to their members of Congress and the state legislature, they're making their voices heard. Frankly, if people hadn't been so energized and activated and out there and working, these bills would have already passed by now, and we would be moving in exactly the wrong direction. The reason we still have a chance of preserving not only the Affordable Care Act, but access to affordable care for millions of people is because you are speaking out, because you are getting organized, because you're literally taking to the streets. I can tell you, and I know there are people watching today who say, you know, what's the point of the protests, and does it really matter? Aren't we preaching to the choir when we protest in California or other parts of the country? And I can tell you this, when you're an elected official and there are large numbers of people protesting, your initial self-defensive reflex might say, well, those people were never with me anyway. But if you keep saying that, you're going to be out of a job. And I think many of my colleagues around the country now who are facing these massive protests realize that all of the energy and the passion among their constituents is among those that want to preserve access to health care. That even their own supporters in these very Republican districts hate the bill that they've come up with. And so they're listening. They're listening to you. They're listening to their own constituents. Those very massive demonstrations of public sentiment really do have an impact. If they didn't, then the repeal would have already gone through. So keep it up. I think it's enormously important. Now more than ever in these critical days where the legislative leadership is deciding what direction we're going to head in, that people know there will be a real political price to pay at the polls if they cut millions of people off from their access to care. So we all know people with pre-existing conditions. They're very much at risk right now. I still love it. One of my constituents who said it best, he said, I'm 65, I am a pre-existing condition. We all hope to live long enough to be a pre-existing condition. So we need to fight for that access for all of us to care. I want to thank you for joining me for this session of Facebook Live. I look forward to doing many more, and for those of you that we didn't get a chance to specifically answer your question today, hopefully we'll be able to answer more of them on Facebook. had a wonderful experience just yesterday of being at Facebook in the Silicon Valley and meeting with Mark Zuckerberg and seeing all the brilliant people working there. And so today was a very fitting day for us to do Facebook Live after I got to see the very home of that creation. So thank you again for joining me. I hope to see you again for another Facebook Live session. But this is Congressman Adam Schiff signing off.